Hi everyone, welcome to Health Tips with Dr. Frempomaa. Today we're going to talk about a common but serious condition, hypertension, also known as high blood pressure. We'll use some everyday items to help explain what's happening in your body if you have hypertension. So let's dive in. But first, if you're new here, don't forget to hit the subscribe button and click the bell icon so you never miss any of our health tips. What is hypertension? Think of your blood vessels as rubber or garden hoses. Blood pressure is the pressure that is pushing against the walls of your arteries, similar to how water pushes against the inside of your hose. When everything is normal, the flow of blood or water in our example is smooth and controlled. Now imagine turning up the water pressure. The hose bulges and the water flows much faster. This is what happens in your arteries when you have high blood pressure. The increased pressure makes your heart work harder to pump blood. Now here's another example. Think of this balloon as an artery. Blowing air into it, the walls stretch. With hypertension, the constant high pressure stretches and damages the arterial walls over time. Just like this balloon will weaken if I kept blowing air into it repeatedly. Why do I have it? Somebody would ask. Hypertension, we can divide it into two main types. It's either primary or essential hypertension or secondary hypertension. And primary usually has no identifiable cause and is associated with genetic and lifestyle factors, whereas secondary hypertension is caused by an underlying condition like kidney disease or hormonal disorders. So let's focus on essential hypertension, which is the most common type. While eating a lot of salt doesn't directly cause hypertension, it can contribute to a higher blood pressure, especially in people who are sensitive to sodium. Sodium causes your body to retain water, which can increase the volume of blood and thus the pressure in your arteries. Lack of physical activity can contribute. Regular exercise helps keep your heart and blood vessels healthy, reducing blood pressure. Smoking is another major factor. The chemicals in tobacco can damage the blood vessels and increase your blood pressure. And finally, genetics can play a role. If your parents or close relatives have hypertension, you might be at a higher risk. Managing hypertension involves lifestyle changes like drinking more water and eating a balanced diet rich in fruits and vegetables and reducing salt intake. Regular physical activity such as walking or jogging can also help your blood pressure. Sometimes medication is necessary to keep your blood pressure under control. It's important to take your prescribed medication as directed by your doctor. At Erama Medical Center, we offer comprehensive care for hypertension and diabetes, including dietary consultations, physiotherapy, psychotherapy, and medical management. We're located in Frempomaa Estates, and our dedicated team is here to support you in managing your health. Now, I'm keeping this video short to make it easier for everyone to understand the basics and be able to watch it over again. Knowing you'll have more questions, feel free to leave your questions in the comments below, and I'll do my best to answer them and make more videos based on your questions. Your health is important to me, and I want to make sure you have all the information you need. Every time I see this craft my children made for me, I remember how important the heart is. Understanding hypertension is the first step to managing it effectively. By making some lifestyle changes and following your doctor's advice, you can control your blood pressure and reduce your risk of complications. If you need personalized care, visit us at Erama Medical Center, Frempomaa Estates. You can find the location in the description below. And don't forget to subscribe to my channel and hit the bell icon so you can stay updated with all our health tips. Thanks for watching Health Tips with Dr. Frempomaa. Stay healthy and see you next time. Bye-bye.